Can the Virgin Islands handle one or more cases of Ebola should a visitor or resident be diagnosed with the deadly virus? This was one of the questions posed to government at a community meeting in Virgin Gorda, and Deputy Premier Dr. Ketchick Pickering said there is no country in the Caribbean that can deal with the issue on its own. Even the great United States have problems dealing with the issue on their own. This is not an issue for BVI or even the Caribbean. It's an international event that needs an international approach. The Deputy Premier said local authorities are working in conjunction with regional and international agencies to have contingencies in place in the event that unfortunate incident happens. In an interview with JTV News about the Ebola virus, Dr. Mitchell Penn expressed similar sentiments.
Any Caribbean jurisdiction, I don't care who you are, where you are, it is going to be a major challenge. It's a major challenge for the superpowers to sit back and to work with this. And I don't mind how Ebola started on its spread. The issue is that we're having a challenge with preparing for it. Which healthcare workers are going to put their lives on the line to manage patients? How well trained are we going to be to handle the cases? Where are the quarantine centers going to be? Are we going to have enough of the protective gear? And to say to government, you must carry the load of this, when it's the whole community's responsibility. All of the large companies that profit very well from the jurisdiction need to come into the conversation and put some skin in the game to basically try to ensure that we're able to protect the jurisdiction. And I think it's very important. That call has not gone out.
So this is a possible disaster, national disaster management issue?
This is a national security issue. That's where the conversation should be.
The government of the Virgin Islands says it is proactively planning mitigation measures to manage the impact of Ebola should it affect the territory through the National Disaster Management Council. Quarantine facilities have been identified at Peebles Hospital and containment arrangements have been made at the main ports of entry. Informing the media through a government press release, Chief Medical Officer Dr. Ired Potter gave assurances that the BVI is making preparation to ensure that any potential imported cases of Ebola are recognized early. He was addressing the Health and Social Service Committee of the National Disaster Management Council at the Department for Disaster Management to discuss preparations on October 10th. Dr. Potter said, in the absence of direct international flights into the BVI will benefit from the screening being done at the various transit points before arrival into the territory. However, border control agencies updated their procedures for the handling of infectious diseases in keeping with international health regulations. Dr. Potter said the procedures were reviewed in detail and tested through a desktop exercise. Dr. Potter gave assurances that the BVI is making preparation to ensure that any potential imported cases are recognized early and brought to the attention of Public Health England, the Pan American Health Organization, and the World Health Organization, on whom the territory will rely on heavily to support the needed response. According to the press release, the committee has also been in contact with PAHO regarding increased stocks of personal protective equipment and making them accessible to health workers and line border officers. The BVI Health Services Authority has developed a refresher training program for all frontline health workers, both public and private, in the use of personal protective equipment and universal precautions for management of persons with infections. These efforts are intended to ensure that health workers are able to treat potential patients safely while minimizing risk to themselves. The BVI Health Services Authority told JTV News that the authority began internal communications with staff about Ebola, and training for frontline healthcare workers started on Thursday, October 16th, and that training will be ongoing.